Hello, folks. Welcome to the Casual Causal Talk, episode 4. Today's guest is a renowned name in the field of causal inference. He has a penchant for explaining complex statistical and causal topics easily. Um, it's my honor to welcome Justin Belair. Welcome, Justin Belair. How are you today?
Hi, Venkat. I'm good. How are you?
Very good. Yeah, Justin.
Great.
I start off with this question to all our guests. How did you get started with causal inference?
Yeah, that's a good question. I don't remember exactly how it started, but I think the first time I heard about it was I saw that Judea Pearl won the Turing Prize, and I think I read like an article or something, and then I went on Wikipedia and I saw it was about these graphical models, and I thought like, that's not interesting. It's too simple. I don't care about that. And then I don't know, maybe a year or two later, for some reason, I just thought, oh, actually, maybe this is interesting. And I read his book, and then I was like, wow, this is really like a revelation because I was trained in mathematics and statistics, and in my curriculum, we never talked about causality, and we kind of never even because it was a very mathematical training, so we never even really discussed design except when I got to like my last year where we started talking about more applied statistics and how maybe randomization can be important for causality and things like that. And then I just like started reading everything I could get my hands on, and I started trying to apply it in my work as a consultant, trying to um, help my clients think causally, use the methods, propensity scores, graphical models, like the basic causal methods. And then I just went from there and started learning more and more, using more and more complex things. Um, a lot of my clients that were social scientists were doing structural equation models. So then I remember that Pearl talked about that. So then I made connections, and just like one thing led to another. And I mean, I'm still like, I still always think that the field is so vast that's like, oh, I don't know much. And there's so many things I want to get more deep into. So it's really fun, and it's been fascinating.
Yeah, I think it's a case with all of us, right? The more you learn, the more you realize that you don't know things.
Yeah,
When I was going through your profile, by the way, I've been following you on LinkedIn for quite some time. I find your posts really impressive, and kudos to you for whatever
thanks.
you're doing. You've created a causal inference group, and of course, you have also written a book. We will come to that shortly. But one thing that struck me in your profile was you were an econometrician first, and now you've transitioned to biostatistics, right? It's pretty rare to
Yeah.
see an econometrician transition to biostatistics. So tell us more about this particular transition.
Yeah. So yeah, I had a few transitions, but I think that's kind of like the fascinating things about mathematics and statistics, right? Is that you can abstract away from the context and you can transfer a lot of the methods. So in undergrad, I was like in math and stats, but I was focusing on a lot of econometric models, but also actuarial models. So a lot of um, applied statistics, I guess, in that sense, with special, like, in actuarial science, we study distributions like the Webble distribution, for example, that maybe in biostats we don't use as much, and things like that. And then I worked in industry and I did a lot of applied statistics, modeling, and very industry focused. But I didn't really like my job because it turned out that all the things that interested me, like the modeling, the research, it was like a small part of the job, and a lot of it was still in Excel and doing a lot of data, like data wrangling. But I love working with data, but it was like these legacy systems that were super boring for me, and like 50 years ago we were stuck with this thing that was implemented 50 years ago. So all that to say, then that's when I went back to school and I did economics. And I was a bit lost. It was a hard decision for me to quit my job and go back to school. It was like emotionally very difficult. And I decided to do economics because I was interested in like I guess doing good. Like I thought, economics is a little bit of a social science, and I'm pretty good at math, so I think in economics I can actually stand out. And I wanted to be an academic, so I thought I have to be really top notch. So these two things, I said, okay, well, there's a social aspect to it that I'm interested. I can do applied work, and I think I can be good at it, and it's super interesting. And so I studied economics, and that's when I think that's actually, I lied. It's the first time I heard about causal inference. I just didn't know it was causal inference because I took a class on instrumental variables. And I read, like, I don't know if you're familiar with, but like the Vietnam draft lottery paper. I did a presentation on that. And then I was more like in the academic route, and then different things happened that made me just stumble upon biostatistics. It's actually like a very fortuitous event. Like I play basketball, and there was like a girl on my team that was a biologist, and I don't know, I was just interested in her work, and I did biostatistics in school. I did consulting like as part of a class project, and I just started helping her, and then I realized, oh, this is a lot of fun, and that's kind of how the transition happened. It was like very natural. Um, I, her lab director hired me, and then one thing led to another, and I just started doing more and more like biological applications of statistics, and so I kind of stopped um, working on economics problems, but I still am super interested by the economics literature, I guess, in the causal inference research, like econometricians, like that are very that have very deep understanding of like quasi-experimental methods and things like that. So I don't do it on a daily basis. I don't usually seek like economic data to do studies or something, but I'm super interested in the methods and the techniques that they develop.
Understood. Would you say that statistics is much more rigorously applied in biostatistics as compared to, let's say, economics?
Yeah, that's a bit hard to say. I think it really depends on who and where. Like some econometricians, they do very impressive work. When you read their empirical papers, it's very detailed. Um, I think they have some traditions that are super good. Sometimes they seem a bit very focused on regression. So maybe sometimes they could benefit from other approaches. Maybe, I don't know. But and in biostatistics, I think like when you look at clinical trial biostatistics, everything that's related to getting FDA approval, since it's so heavily regulated, you're kind of forced to be very rigorous in your approach if you want, for example, to get a drug approved. Well, there is like hundreds of pages of guidance that you have to implement to meet the FDA standards. So obviously they are super rigorous, but in my experience, for example, working with biomedical researchers, they are not rigorous like at all. They I have some clients, for example, they're doctors that they do clinical practice, but they also do research, and they are very limited in statistics knowledge because they spent all their life studying medicine, and that's already complicated enough. So that's why I like to help them, because they have interesting research ideas, but they do not know like how to do like a mixed model or something. Like they are really basic. They do not even use regression and things like that. So it really depends on who and where. Like it's hard to say as a whole which one is more rigorous, but I think there is different degrees in each field.
Yeah, I mean, one of the reasons that I follow biostatisticians is because in my field of marketing, quite honestly, statistics is not applied that rigorously. I wish it were, but I learn a ton from people like yourself, Adrian Olszewski,
Yeah,
Darko, and
yeah,
of course Jeffrey. So these people, I follow them on LinkedIn, and all the statistical rigor that needs to be adhered to, I try to apply it in my field of marketing itself. Yeah. So
yeah.
living up to our, talk name, the casual causal talk, let's talk about causality. How would you go about explaining causality in three levels of difficulty? Now, this is inspired by the Wired, the YouTube series. So there are three levels, right? One is the grandma level, then there is the college fresher level, and the third is the causal expert level. So if you can explain causality to all these three people, how would you go about it?
Yeah, that's a good one. There's so for like my grandma, that's actually a real scenario because she's always interested in what I do, but I yeah, obviously she does not have the knowledge to understand me like most people in my family that are not mathematicians, but um yeah, I think causality, the way I would explain it is very simple, right? Is if I do something, what happens? I think that's one way of understanding causality at a very basic level. So um, humans, we understand it very intuitively, right? If I tell my grandma, well, grandma, look, when you put your egg on the frying pan, it will cook, but only if you put some heat, right? And so the heat is causing the egg to cook. If there was no heat, the egg would not cook. So that is like very basic causality that we are understand very intuitively. And then when you move up to a more nuanced understanding, this is for a college fresher. So let's say that they are pretty curious and they like to think a bit more. I would already be comfortable talking about a counterfactual, right? So if my egg cooked, I can imagine what would have happened in an alternative world where I didn't put the heat. Well, it's pretty easy to understand that the egg would not cook. But when we get to more complex problems, like we give drugs to patients, it is a lot more complicated, right? So if I have a headache, okay, you can ask what caused my headache. Then you see like, okay, maybe it's because I drink too much coffee. Okay, so then you can think, okay, maybe in an alternative world I did not drink so much coffee, so I am not suffering from withdrawal symptoms. So then you can say, okay, maybe the coffee is causing the headache. Or you can say, okay, now I have a headache, I take a pill. Um, okay, now I feel better. But okay, in an alternative world, if I didn't take the pill, maybe I would still feel better because my headache just went away because I drank water or I took a nap or something. So as soon as we get to a little things a little bit more complex, less controlled, it's very difficult to understand like what is really causing the effects I see. So a lot of scientists they're super interested in that, and it turns out that well you have to use data, but then you get stuck because you never see the counterfactual world, right? You can never take a person and not give them the pill and give them the pill at the same time. That is not possible. So you need at least two people, but then these people are different. So then all this brings complications, and that's why it's a whole area of study that is both methodological but also very philosophical in a sense. And for a causal expert, I mean, maybe I wouldn't have much to explain to them because they are experts, but I would explain that, at least in the modern sense of causality, there is a few ways to understand it. So there is this counterfactual world approach where you try to simulate how to have data that could represent what would have happened in the counterfactual world. And there's different ways to do this, right? So the randomized control trial, that is a way to do it. Because of randomization, you get these counterfactual treatment and control groups that you can use to kind of infer what would have happened in the population if I had not given them the drug. And this is why you are able to detect causal effects within statistical error. So you also have statistical uncertainty that comes from just the nature of having limited data and things like that. Um, and you can also look at it more in Pearl's point of view, where you have these systems of interacting variables and you do interventions in the system, and this changes how the system behaves. And you can study the distribution of the variables under the intervention. And if you are clever enough and your system, you have a good model for your system, it turns out that you do not need to actually perform the intervention. You can just observe the system and infer some causality in certain cases just from observing the system. But in other cases, you need to actually perform the intervention to see what would happen. So I think that would be the three levels. I hope that it was good for my grandma, especially. I hope she understands what I tried to tell her.
No, these were really excellent examples, Justin. Uh, Yeah, and thanks for first of all providing early access to your book to me, right? And I read the book and I find it really well worded. There are a lot of great examples out there. And one thing that I liked in your book, just like Matthew Stackway's book, is that you didn't try to dumb down things too much, and you stayed true to the concept there. One of the
Hmm.
things that I always like to do in any textbook is that I want to read the preface just to know what the author was thinking while penning this a book. And I read your preface as well, and I found it really intriguing. And I have a couple of questions on that. But very firstly, I want to ask, why did you name your book, Causal Inference in Statistics?
Yeah, well, because well, I'm a statistician, and my goal is to show that in statistics we have a lot of tools that we can elevate if we have a causal mindset, if we learn about these causal abstractions that might be a little bit uninviting at first, but it turns out that a lot of causal inference is already baked in a lot of things that we think about when we learn statistics, especially when we do applied statistics with when we start talking about design and controls and adjusting for variables. These are all concepts that come from our desire to detect causal effects. So I would have liked in my statistics training to be exposed to causal inference earlier. And I hope that by picking this title, statisticians can understand that they are very well placed to be causal experts. There's just some additional machinery you have to learn, but a lot of the tools that we already know, they are very useful for causal inference. So it's kind of what motivated me. Maybe some curious stat students will be interested to read my book and elevate their understanding of causality and their understanding of statistics with the causal knowledge that I'm trying to explain in my book. And just before, just wanted to say thank you for the comment. I hope that the book is useful to you and others, and I'm glad that you liked it.
Yeah, I certainly did. And is there a particular date where it's available for all?
So right now, the I'm pre-releasing portions as I go.
Mhm.
So I don't have an official release date, and also it's not like edited. It's still like a draft form. It's pretty polished, but I didn't do editing yet. So right now, if you pre-order the book, you can get the first three chapters, and there's code notebooks with it. And I'm planning on releasing two extra chapters probably by the end of the summer. And it's hard for me to settle on a date because as a consultant, sometimes I get good opportunities and I have to write a bit less and focus on my work. But if everything goes well, I should have a few months at the end of the year where I can focus on writing. So I'm hoping that early next year I should be finished, at least writing it. Then I can send the full draft to the people that pre-ordered it, and then I will go through the editing process and to prepare it for physical print. So yeah, that's kind of what I'm hoping for.
Yeah, and I'm sure people will be awaiting the release of your book very soon. So getting back into your book, right? Just talking more about the preface, I noticed that you have the word causal inference revolution is an intellectual revolution. Why do you
Mhm.
say so?
Yeah, so it's funny because I um I wrote that before reading the Book of Why, and then I realized the Book of Why is by Judea Pearl. It's also part of his narrative that we are going through this revolution. So it was funny to see, maybe people will think that I took this from Pearl, but actually it was from just, I mean, to me, it's clear that a lot of scientists were struggling with causality, a lot of tools that they used. So, for example, in epidemiology, we have these designs that are made to make sure that we are not measuring effects that are not causal, that are confounded. Or in social sciences, we are taught that we should adjust for certain differences in our models, things like that. And all these concepts are causal, but we were lacking the theoretical, and when I say theoretical, I guess I mean mathematical language to express these ideas. And a lot of science, when we are able to formalize the ideas mathematically, that is when we really understand them. So I think the revolution, and Pearl says the same thing, is really about finally, after all these years of struggling with causality, we finally have a mathematical language to express what we mean. And this generates a huge advance for science because now when we talk about causality, it means something very concrete. So we can debate about that and not be stuck um, in a sense with philosophical, in philosophy, the debates, they are very interesting and they progress, but it is very hard to progress on causality when there is no formal language to express it, right? There is different points of views, different words. We get stuck with definitions. Now we have mathematics, so we can debate about that. And I think when I read Pearl or even Rubin's work, you realize that, again, all this has been kind of bubbling in the back of scientists' minds for a long time. It's just a good scientist did it intuitively. They understood how to make sure what they're doing is causal. But now we don't need to just do it intuitively. We can actually have more rigorous tools to do it formally. And these ideas, for example, the counterfactual or the potential outcomes ideas of Rubin, he attributes them to the time of Fisher and Neyman, and he has a very interesting paper where he says, well, yeah, we call it the Rubin model, but I didn't really invent this. Like Neyman did it in the 20s. It's just that it was never pursued, or they didn't grasp how fundamental the idea was to talk about the unobserved value that we would have seen if we had withheld the treatment or something. So all that to say is that I think it was a long journey, but now it's like we are in this explosion of causal knowledge, and every field is interested in it, in empirical science, and even in industry, there is a huge interest to augment data science with causal understanding and things like that. So I think that is the revolution.
Great. I think in your book, you have stated that we stand on the shoulders of giants. I totally agree with that. And you
Hmm.
also give credit to a lot of school of thoughts when it comes to causal inference, right?
Yeah.
You talked about Pearls, Imbens, then Rubin. There are so
Yeah.
many schools of thought. Uh,
Hmm.
where do you personally align? I'm not trying to straitjacket you, but uh, do you have a specific preference of school of thought?
Yeah, that's a good. It's funny because if I read Pearl for a month, then I'm like, wow, Pearl, he understands everything. And then I read Ruben, I'm like, but I think Ruben, he understands everything. And then I read Pearl, I think Pearl, and then it's like that. It just goes back and forth like that. And that is, I think, part of my personality is like I do not like adhere strictly to schools of thought or even political preferences. I don't know. It's not natural for me to like really want to think something and not anything else. But what I can say is that I think I think in some sense I really like how Rubin's ideas tie very neatly into everything that we developed in the 20th century following Fisher about experimental design and randomization, and um, that is a very appealing part for me of Rubin's ideas, and how that, in a sense, Rubin's um, Rubin's model or Rubin's theory is less heavy in a sense. It's very abstract, which might be off-putting for some people, but I'm a mathematician, so when you can summarize a lot of ideas in a very elegant model, I think that is good. But on the other hand, Pearl is also very mathematically rigorous, but it's a lot more work, a lot more mathematics to get to the ideas. So I think they have both strong and weak points because Perl, you have this more tools. So I think that's why it's very useful in industry. It's like you have more ways to answer your questions, whereas Ruben is like very, it's so abstract in the sense that sometimes you're left wondering like, does this really work? So I'm not settled on which school of thought I like, but I also like and this is a little bit what I do in my book. I like the Hernan Robbins school where they kind of take the best of both worlds. They are epidemiologists and biostatisticians. And, if you read their book, um, they talk about potential outcomes, they talk about DAGs, and Robbins formalized the unification of both that I haven't read yet because it's like a 200-page paper that's pretty dense, but I want to read it because the promise is that we can unify these frameworks theoretically, and that to me is very appealing. So I think as an applied statistician, what I advise in my book is just to use the tools that help you answer your questions. You do not need to worry about the foundational questions. And as a mathematician or as a curious person, I'm very interested in trying to unify these ideas theoretically so that we can stop worrying about who is right and just, okay, we have a theory that unifies these ideas because there are both different ways of thinking about the problem, but if they are true in a sense, there should be a unified way of talking about these ideas.
Understood. Uh, I mean, as we talk about, these giants, Fisher, Neyman, Guido, Pearl, etc. One thing that strikes me is that the pendulum has kind of like swung back and forth. I mean, if you look at the 19th and the 20th century, the emphasis was more on getting to know things, why behind all the processes, and that's why Fisher designed the experiments, the randomization. He
Hmm.
wanted to know why. But then fast forward to 21st century, I think you remember the paper from Leo Bremen, the Statistics to Culture, where he kind of, admonished statisticians that, hey, why are you too much focused on the inference? I think you ought to be focused more on the predictive side, right? I think now the pendulum has swung again on the other direction, and people are more asking about causal inference. And that's why, we are all talking about causal inference now. And people
Hmm.
have shown a lot more interest to apply causality not only to our classical domains but also to LLMs. They want LLMs to be causal. Do you
Hmm.
think the pendulum will swing to the other side where people say, "Fuck it, no, you don't have to worry about causality anymore. Let's go back to predictions."
Yeah, I mean, it depends on like what you are trying to do, right? If you are trying to send a notification to your client that will increase his chances of buying something, maybe you just care about an accurate prediction. You don't care what is the mechanism that leads to the behavior. Maybe if you understand the mechanism, your intervention can work even better. But um, if you are a scientist, well, having a prediction is maybe not useful. Or if you are an epidemiologist, for example, and you say, well, based on my understanding of correlations, uh, people that drink coffee are smokers in higher proportion. Okay, I want to reduce smoking in the population. If I make an intervention on coffee, probably it will change nothing because the link is not causal. It is just correlational. It is a spurious correlation, as we say. So it depends on your focus. Um, I think if you are doing science, you cannot escape the causal question. It is always at the end, not always, but a lot of what we are interested in science is causality. If you are doing applications in business, again, it depends, right? I think a lot of tasks can be perfectly um, um, can bring value in a purely predictive approach. Um, but I think other tasks, sometimes we put a predictive approach when we are actually trying to understand a causal mechanism. So, for example, you work in marketing, right? Well, okay, it can be good to predict the return on investment or something about your ad campaign, but what you really want to know is not the correlation. You want to know, okay, if I put more money, will it increase sales? And that is a causal question, right? It is not a predictive question. So maybe in marketing, they would be interested in learning more about causality, for example. And I know that you talk a lot about it a lot. So it really depends on the problem. So um, I think there is this, sometimes I don't know if it's like social media or if it's just the way that we talk about things. It's like, like, oh, well, prediction is garbage. You need causal inference. Okay. And I don't think it's like that. I think it really depends on what you're doing. And a lot of problems can be solved with predictive techniques. And even causal inference, one way to do causal inference is to impute the missing counterfactuals that you didn't see. And you can use strong predictive techniques to do that, right? Because you are just trying to predict the value and then you do the causal inference based on the predicted values. So I don't think it's as exclusive as we sometimes think about it. Um, and I don't remember, did you have a question about LLMs in there somewhere?
Don't worry, we'll cover it later. Yeah, I mean,
Okay,
I,
okay.
I asked this question to all our guests, and whether they think LLM should be causal. But yeah,
Mm.
we'll touch upon that later on.
Yeah.
But yeah,
Okay.
talking more about causality, right? I mean, you are a econometrician who transitioned into biostatistics. And as you know, to prove causality, there are two ways, right? There is the standard RCTs, randomized controlled trials, and then you have the quasi-causal methods. Which one have you used more? Historically, what I've seen is that people who are on the econometric side, they rely on quasi-causal methods, and we on
Hmm.
the marketing side also rely on quasi-causal methods because we have only observational data. But on
Hmm.
the epidemiology side or the biostatistics side, I don't think observational data is that common. Maybe it's more experimental in nature. Can you
Hmm.
talk more about this?
Yeah. Um, so in biostatistics, we have a lot of opportunities to do controlled randomized experiments. So that is very, very prevalent. But even in biostatistics, there is this growing desire to use what they call real world evidence. So that is kind of an industry buzzword in pharmaceuticals, because there is so much data that is generated in the real world just by patient interactions in hospitals or with insurers and things like that. And there is these cases where even in biostatistics, even in drug development, you have these edge cases where you cannot perform the randomized trial. So, for example, if you are studying rare diseases and you want to develop a drug, it is unethical for someone that has a rare disease to withhold treatment to them. Because if there is only a limited treatment, you have to give it to them by ethical medical standards.
Mhm.
So if you want to understand the causality of your drug, does it have an effect on the patient that is beneficial? You are forced to control using patients that did not receive the drug, but not as part of a randomized intervention. So you fall into observational data. Not you cannot even like really sometimes design your data collection like we would do in epidemiology. So in epidemiology, what they do is that they use the design of how the data is collected to validate or make plausible certain causal assumptions. So for example, in epidemiology, they are very keen on doing prospective cohort studies. Why do they do that? Well, they do that because you make sure that the temporality is correct when you choose people in the trial before anything happened and you follow them over time and you monitor, for example, their exposure to cigarette smoking. And over time, you see the ones that were exposed to cigarette smoking, how do they differ to the ones that did not smoke in terms of an outcome, for example, lung cancer rates. So the problem with this is just that it takes a lot of time. It's very expensive, but the causal conclusion is very robust, provided that you understood the mechanism enough to control for all the confounders and things like that. But if you just have a database of people and you look at it retrospectively, well, then there is more complications about the timing, right? Did the cause come before the effect? If that did not happen, then it is not causal, and things like that. So I think both. I use both in my work, um, but the there is a growing interest in even in fields that traditionally did not do observational data to try to leverage our understanding of observational data. The FDA, for example, is open now to approving drugs based on non-randomized trial data. It's more complicated, but there is this openness, and they are developing guidance and documentation to help companies meet the criteria of the FDA to get drugs approved, or even when you develop a drug, right? You do a trial, even if you do like a huge trial. Let's take the COVID vaccine example. The final trial I think was on tens of thousands of people. So you do a trial, okay, you get very conclusive evidence. The causal effect was very big and it was randomized. Everything was really neat. But then you deploy it to millions of people. And if you have a side effect that is 1 in a million, you cannot detect it in a trial of even with 10,000 people. So there's also this whole area of biostatistics that is related to what they call pharmacovigilance, where you put a drug on the market, but you still monitor the patients. But now it is not experimental; it is purely observational. So you need
Hmm.
causal inference methods to understand, is this drug causing a rare side effect? So in the COVID case, there was this concern with heart problems like thromboembolism, I think it's called.
Hmm.
That was like a 1 in a million event, but now you are giving it to millions of people, so you start seeing it. But this is not experimental, so you need causal inference, and it's a very important part of the biostatistics and pharma industry because you need to make sure that you are not harming the patients more than you are benefiting them, right? So there is always this trade-off, and you cannot do that without causal inference. So there is an openness to more and more to understand the power of observational methods in fields like that.
Yeah, is this somehow related to the concept of external validity in causal inference?
Yeah, that is basically like there is this paradox, right, where the more you make a study internally valid, right, the more you take a very precise population with a very defined intervention and things like that, the less it resembles the real world. So you have this paradox where, okay, you have a very defined population, the treatment is highly standardized, it's given in a very strict protocol to the patients. Then you have a high internal validity. But then there is the paradox where, okay, well, what will happen in the real world? Because people will not take the drug every day, they will forget, they might take other drugs with it. And then, so you have this trade-off where you cannot get both in one study. You need many studies, many approaches. Um, and on the flip side, right, if you do a randomized trial, for example, in A/B testing with online testing, well, if you just expand and expand and expand who you give it to and you try to get more external validity, well, then you do not understand like how it applies to particular people in a precise way. So you cannot do everything in one study. So you need complementary evidence that from different sides to get both internal and external validity. And there is a very interesting book about causal inference that is not mathematical at all, but it is pretty deep and it is not easy to read. But it's the Shedish, Cook, and Campbell book. Um, and their whole theory of causal inference is about the trade-offs between different validities and how you can use quasi experiments to strengthen different parts of internal external validity. And they have a lot of esteem and they put a lot of hope in the quasi experimental approach. They are social scientists, so in social science, and I think it's very convincing arguments and very interesting thoughts about how we can design experiment or quasi experiments that are internally valid, some that are more externally valid, and we can use a whole range of studies to understand the phenomenon, not just one.
Yeah, I mean, in the field of marketing, apart from
Mhm,
MM, we also carry out a lot of causal experiments. And as you know, all we have is the observational data. The best
mhm,
that we can do is quasi-causal, experiments. So once I went to the CMO and I explained to him that, we will not be able to RCTs. RCTs are generally not possible in marketing, and we will be
mhm.
using, a quasi-causal technique like DID, difference in
Yeah.
differences. He
Mhm,
was like, I think quasi means something like false causal. I don't know. The word quasi has a negative connotation. Why
Mm.
do you think that is? I mean, I of course did explain to him that it's not the case, and we are still establishing causality. But I don't know how this notion came into the people's mind.
Yeah, I think it's like this misunderstanding, even when you just purely use statistics and you don't even care about causality, there is this misunderstanding that if you are using assumptions to draw your conclusion, that somehow your conclusion is not good, right? It's like I think it's the same idea when you are obsessed with using non-parametric tests because somehow they have less assumptions. Assumptions are there to help us, right? And even our RCT is based on assumptions. Um, a quasi-experimental method, if you believe your assumptions, then it is as valid as any other technique, right? Then we can debate about the assumptions, but if you are not, um, Rosenbaum has words about this. He was a student of Rubin. He's a very important statistician in causal inference. If you do not have a credible claim to dismiss observational evidence, whether quasi-experimental or whatever, you cannot just say, oh, it is observational, therefore it is not good. Like, okay, but why? Let's talk about what do you think is not good. And then if you cannot point to a certain theoretical assumption, for example, in differences, you have the parallel trends assumption. Okay, if you are able to validly show that maybe the parallel trends assumption is not plausible, then we can question the causality of your claim. But you cannot just say, it's differences in differences, it's not randomized, it does not work. That is not science. That is just being a contrarian for no reason.
Yeah, I agree. There is also this concept about causal discovery. If I'm not wrong, you also talked about it in some of your LinkedIn posts. Uh,
Yeah.
to educate people, the difference between causal discovery versus causal inference. How would you go about it?
Yeah. So let's take Pearl's framework because that is where we do causal discovery. So, right, when you take Pearl's framework, if you do causal inference, you have a question you're interested in about the effect of a variable on one other, and you have a system of interactions like this variable causes changes in this variable, and maybe you have a handful, who knows, 10 variables, and you draw a diagram of variable one causal, it has a causal impact on variable two and variable four, right? And you put arrows and you draw your system like that, and then you use Pearlian techniques to study that system with data. That is causal inference. You are trying to understand a system of variables, estimate quantities, and decide if the quantities that you estimated help you draw a certain causal conclusion. In causal discovery, you go the other way. You say, okay, I have data, um, and I want to understand what would be the arrows I have to draw between the variables in my data. And it turns out that under certain conditions, you can deploy algorithms that search the data and they can come up with plausible uh, causal graphical models to describe the data. The problem is that in Pearl's theory, there is the concept of observational equivalence, which basically means that two different diagrams, or two, three, or four different diagrams, could all lead to the same observational patterns in the data. So the causal discovery algorithm cannot differentiate between these diagrams because the observations we have do not contain information about the differences in the diagrams. So then you can use expert knowledge, or sometimes maybe one diagram does not make sense because there is a notion of temporality, or you just have an understanding of the system that you can force the model to exclude certain options. But the hope is that in very high data environments, like for example, I saw a demo with a startup in Germany that was developing a causal discovery tool. And what they do is they create this big data model. For example, they did a case study with a manufacturing company. The manufacturing company has sensors all over the place. It has this huge set of data. And then you just throw the algorithm at it. And the algorithm says, okay, this is my hypothesized causal interactions in the system. And then you can use that to maybe increase the performance of your processes. So, for example, they had a problem with a certain part that was having high rejection rates in quality control. So the manufacturing process was a little bit off. And they didn't know why. You want to know what is the cause of this, but there is so much data and it's so complicated. But the algorithm can kind of use the power of computing to bring down the problem to where, okay, this is my hypothesized interactions, and then a human can look and say, but this causal chain might be what is causing the problem. And it turns out in the case that they showed me that it was right, and they were able to correct the process. So I think causal discovery is a very promising tool for industry. To be honest, I am not super well versed in the techniques. I know the basic ideas and the basic algorithms. And I wonder if it will be useful for science and in what capacity. But I can see why in industry it can be like a super useful tool to try to understand some causal processes in different systems.
Great. Just because you brought up the topic of arrows, let's talk about DAGs.
Yeah.
Historically speaking, econometricians have never liked DAGs, but epidemiologists and biostatisticians, they loved it, right?
Hmm.
There is also this the famous debate on the internet. There's a blog post on, I think, written by Daniel Pearl, on which Guido Imbens has commented on a series of things. I think the belief is that sometimes DAX can be misused. And I totally agree with it. A lot of people misuse it. They just draw a DAX and just to create an impression that they are an expert in, causality. But just because you can draw a DAX doesn't mean that you have established causality. For me, it's a hypothesis generating mechanism. How do you see it?
Yeah, I think it helps, as you say, as a hypothesis generating mechanism. I think it's a valuable tool, and I understand why econometricians are wary of it. I mean, I'm not a historian, but what I understand from the
I
evolution
think
of
you're the best person because you transitioned from econometrician to
yeah,
bio. You have the best of both the worlds view. Yeah.
yeah. What I understand that happened in economics is that they were not using DAGs, but they were using structural models,
Hmm.
which eventually Pearl's framework ends up being just a set of structural equations that are encoded in the diagram. But so, what is a structural equation? It basically is you just postulate that an equation is causal, right? That the variables on the right hand side are causing changes in the outcome variable in the left hand side of your equation. But then they used a lot of that, and then well, it's convenient because you can use regression to estimate the parameters of these equations. And then in economics, there was a crisis, and there's a famous paper, and I mention it in a footnote in my book, where I don't remember exactly the quote, but it's something like nobody trusts your data analysis because it is heavily reliant on these structural equations. It is too complicated. And there was this crisis of confidence, and econometricians then the Imbens and Angrist and all these people, David Card, they started going away from these techniques and relying on quasi experiments or natural experiments.
Hmm.
And then this is what they call the credibility revolution. So they are a bit wary of these complex structural models, which in the end, Pearl's framework is a diagram that just encodes a structural model.
Hmm.
They are much more um, um, able to trust a designed quasi experiment where you have more control over what you do, and you can validate your causal assumptions more precisely. And I have a penchant for that approach. I think it's more convincing when you design a quasi experiment in a way that allows you to be more confident about your assumptions than if you just take a data set, postulate a DAG, and call it a day, right? Because I think there is this misunderstanding that when you draw a DAG, you are assuming that everything is causal already. Like you are kind of putting in your causality in the DAG. And I think they both have their place, but I think in quasi experiments, a DAG doesn't really help you understand what are the assumptions you need to meet. It's hard to encode that in a DAG. But if you are just looking to understand, like, oh, what variables should I adjust for? A DAG is super useful. But the DAG doesn't tell you how do you estimate these parameters? What is the variance? How many degrees of freedom do you have on your estimation? Things like that that are important to statisticians. So I think it's important to understand different limitations of different techniques. And DAGs are so intuitive that I think they are a great teaching tool. I think they are a great hypothesis generation tool. I think they are great to understand what variables we should adjust for, given that the DAG, we assume it is true. But then you can go, okay, let's draw a few DAGs and see what happens and what were the conclusions we would have with different DAGs, things like that. I think the important thing is to not be dogmatic and understand that causality and detecting causal effects is difficult. You cannot just do it on a Sunday morning. You need to think about what you're doing and what is the process, what is the data. You need a lot of domain knowledge because the causal assumptions are not testable. I mean, you can test certain things, but you have to always at the end judge, is my set of assumptions plausible or not? So you have to think and you have to know a lot and you have to work hard. It's not easy.
Yeah, thanks for that elaborate answer. In your book, you cover the classical causal methods, starting from, DID, synthetic control methods, propensity score matching, and then you go all the way to the, more uh, novel, I would say, the double ML and all that. So talking about quasi-causal experiments and the reasonableness of their assumptions, let's play a small game and we can
Okay.
talk about each of these methods, in much more detail as we play along. Basically, what I'm trying to get at is that, what do you think about the reasonableness of the assumptions? Because I have seen a lot of practitioners either being too stringent about their assumptions or being too lax about it. There's probably some middle ground. So, I would love to, hear your thoughts. So let's start this game and I would love to have your view.
Okay. I'm excited.
I hope you can see my screen.
Yeah.
All right. There you go. So let's start with DID's parallel trends assumption. I know we talked about it briefly earlier in the
Mhm.
talk, but what do you think about this particular assumption? Should people be too stringent about it, or they can kind of like be lax about it? Where would you place DID's parallel trends across these three buckets? Is it a reasonable assumption, unreasonable, or simply impossible to have it?
Okay. Do we assume that the people know what it is, or should I say a few words about it before?
Yeah, you please go ahead, no problem at all. Right.
Okay. So parallel trends. So in differences, you are using a control group um, that you measure how it evolved over time, and you are using that as the counterfactual to the treatment group, and you are estimating the causal effect by assuming that the treatment group would have evolved the same way as the control group had it not received the treatment. That is the parallel trends assumption. So, yeah, it's hard. I think it's reasonable in certain contexts. I think it's one of the most reasonable assumptions if you do the proper work. So, example, I would put it in reasonable just because I think it often can be. If you have a long series of pre-treatment observations in both
Mhm.
the treatment and control group, and the long series of observations are similar, well, then you have a strong um, case for parallel trends. Also, you have to make sure that there is not like something happening at the same time as the treatment that could cause the differences you are seeing, right? So, a lot of domain knowledge and a lot of pre-intervention or pre-treatment data could make this assumption extremely reasonable, and it's a super powerful design in that case. So sometimes you just have one observation of pre-treatment data, and then okay, then you are relying more on your judgment if the parallel trends make sense. But if you are able to collect a few time points before and see that they are evolving in the same way, then you can have more um, plausibility. You can give more plausibility to the assumption. You can use it as a more reasonable assumption.
Yeah, I agree with you on this, in the sense that, when it comes to DID's parallel trends, at least you have a control group to begin with. And yeah,
Exactly.
it may not be an exact match for your treatment group. You can never expect it to be, following a proper, perfect parallel trend, but it can be close enough. In marketing, I have never seen a perfect, control market, but
Yeah.
we can come close to it. And I believe in your field also, it could be the same. But yeah, thanks for your explanation on parallel threads and placing it I think in reasonable bucket. Next we come to SCMs, that is synthetic control methods, synthetic twin assumption. What do you think about it?
Yeah. So the synthetic control twin is the idea that you have a case that you consider the treated case and you want to compare it, but you don't have a proper control. So they use this a lot in economics. It comes from economics. So you want to understand the evolution of, I don't know, the market of a country, but you don't have another country that is similar on all the factors that you want to control for. So what you do is, instead of comparing the country to another country and saying, oh, look, it is different, but you do not have as much of a close match between potential confounding factors between the two cases. What you do is you say, okay, I have a country, I want to understand the evolution of one of
Mhm.
its markets, for example. Okay, let's take a whole pool of countries and let's create a synthetic comparison where we use a optimization algorithm to create a synthetic portion, a synthetic control that gives a portion of credibility to all the control countries. And if you do that right, then you have a synthetic control that is similar to the country. It does not exist. It is a thought experiment. It is a mathematical tool. But then you can compare the synthetic control with your treated country, the one you're interested in, and then you can use a bunch of techniques to make inference with that. Um, to be honest, I'm not sure where I would place it because I think the idea is very compelling. So I would tend to put it in reasonable, but I think you need to do a lot of checks on your synthetic control before just. I would not just put the data in a software package and just take the results and run with them. I think you need to play a lot around and make sure that your synthetic control makes sense. You can plot how it evolved over time. Does it match your case that you are studying and things like that? So I think it has a lot of promise. I think it can be super convincing, a little bit like difference in differences, but it's not free out of the box. You need to, again, make sure that you understand what you are doing in your particular data set.
Yeah, so would you say from a practical application standpoint, it falls somewhere in between reasonable and unreasonable, or would you say it's totally
Yeah,
unreasonable?
I think it would fall in between. You're right. I think that's the perfect
Okay,
one. Yeah.
let's take the middle ground. Let's keep
Yeah.
everyone happy. Yeah. Yeah, let's talk about regression discontinuity design, right? I mean, in marketing, we don't use it that much, but I have read about it in causal inference books.
Mhm.
But I'm given to understand that people in the biostatistics, they apply RDD a lot. Can you talk more about it? And what do
Yeah,
you think about the assumption of the sharp
yeah,
cutoffs?
yeah. So regression discontinuity is it was I guess invented, or at least the in the literature we ascribe it to Donald Campbell and Thistlethwaite, and the book I talked about earlier about Shadish, Cook, and Campbell about quasi experiments. It is the same Campbell, and his idea was pretty ingenious. He said, "Well, we have these students that when they meet a certain grade, they are put into a program where they get a lot of exposure to um, different." Right, that their name is put on lists and they are published in journals and things like that. And he wanted to understand, well, does this exposure lead to more intellectual achievement later in life, more intellectual careers and things like that? And the idea is ingenious because when you have a sharp cutoff like this, where you say, if you get 61, you are in the program. If you get 59, you are not. Okay, so you have a cutoff, a perfect cutoff at 60. And if you are at 60, maybe we randomly choose or something like that. The idea is that at least for the people that are close to the cutoff, you can assume pretty plausibly that falling on one side or other of the cutoff is essentially random, right? There is some random component. You took a test maybe that day, random weather effects or random you had bad sleep or things like that that are out of control and that we can assume are random are what really made the difference if you fell on one side or the other. Another famous example is the Lee paper that I study in my book, where very close elections, you can assume that it's essentially random who won, right? Because the the weather or some random factors affected the turnout of the vote, and when you are very close, it's basically a flip of a coin of who won. So locally, in these situations, you have a mini randomized experiment, and that is very compelling because you can basically infer the causal inference. So if you are able to detect these cutoffs, a lot of times social scientists, economists, they find these arbitrary rules that we create in our societies for administrative purposes where we have sharp cutoffs because we cannot do a gradual cutoff. Then you can exploit these discontinuities to estimate treatment effects. So they are very plausible and very reasonable. But the problem is that it is very localized to the units that are around the cutoff, right? So if we take the test score example, the people that are close to 60 and we cut off at 60 if you get into the program or not, the causal inference for them is very strong. It's very plausible because they are very close. There is no reason to think that a 61 and a 59 are that different. But as you go further, people that have 80 and people that have 40, and you go further along the scale, then you are relying on model extrapolation. So if your model for how they progress is misspecified, then your overall treatment effect will be biased. So what economists do is they develop very robust methods to estimate the local effect. But technically, if you have the right model, and of course, you never know if you have the right model, but if your model is the right one, in the sense that it is the true data generating mechanism, you should, in principle, be able to get the overall treatment effect, the average treatment effect. But usually what people do is instead of relying on trusting the model, we just estimate the local effect and we call it a day. We say this effect is good for the people that are close to the cutoff, and for the rest, it's hard to know, and we need to extrapolate. So again, I think that would fall in the middle because it depends on how you're using the inference, right? If you're just calling it a day, oh, people close to the cutoff, it works.
Mhm.
But usually we are interested in extrapolating the effect to other people that are not necessarily close to the cutoff, and that might be a bit more difficult.
Yeah. So next is a SUTVA or a stable unit treatment assumption in
Yeah.
biostatistics and econometrics. How reasonable, unreasonable, or impossible you think that is in these respective fields?
Yeah. So the stable unit treatment value assumption basically means that whatever treatment a unit receives is independent of what another unit would have received. So this is very context dependent, and in a lot of contexts, it is not reasonable, especially in observational data.
Mhm.
So in a randomized experiment, right, you have, I don't know, you have a treatment and a placebo. The treatment is highly standardized. It's given according to a strict protocol. It is monitored. Well, then the SUTVA assumption is reasonable because you only have two treatment values and you can compare them and they're highly standardized. But in observational studies, I don't know, you say, what is the effect of smoking on cancer? Well, what is smoking? Like one cigarette a day, two cigarettes a day, a pack a day? The treatment values are not identical. So that is one way you can violate this assumption. So what you usually do is you take, like, I don't know, four categories: non-smoker, light smoker, moderate, and heavy smoker. But even within those categories, there is variability of what is the
Mhm.
treatment. So this can bias your estimation. So that is one way. Or another example, okay, even smoking, I mean, you are influenced by people in your entourage, probably. So if one person in your entourage smokes, it affects if you smoke or you don't smoke. Probably it increases your probability of smoking. So it is not stable because for causal inference, you should not, the fact that you smoke or not should be independent of whether the other units in the data
Mhm.
smoke or not. And that is often not true. So one way you can make this assumption more reasonable is to put the unit of observation at a higher level, for example, a household, and then you can use different statistical techniques to control for the correlation in the household and things like that. Economists, they do it a lot. Instead of studying students that are put in educational programs, they study classrooms or even schools, and they measure the students, but they have correlation models so that the actual unit that is more likely to meet SUTVA assumption is the school or the class, not the individual students, because there is peer effects and things like that. So I think that is between unreasonable and impossible. In a randomized trial, it is highly reasonable, but in observational data, it is often more problematic.
Great. Yeah, so far I agree with all your you know answers here. And the last one is perfect balancing in propensity score matching. How reasonable, unreasonable, or impossible you think it
Yeah.
is?
Yeah. So propensity score matching is the idea that we estimate the propensity score, which is the probability of getting treated, right? In a randomized trial, you know that probability because you created the trial and you flipped a coin, let's say, to decide who gets the treatment or not. But in observational data, you do not know. So you have a model to estimate this probability, and then you use that, I guess, to say it simply, to kind of simulate a randomized experiment, what would have happened in a sense. The problem is that you can never be sure that you put all the important variables in your model. So there is the
Mhm.
problem of unobserved confounding variables. The other problem is that there is this trade off. The more you want the match to be good between the treatment and control. So, for example, you have a pool of units or patients or whatever of that you want to match. So you estimate their propensity score. So each people, they have the analogy is like they come in with a tattoo on their forehead of what is their probability of getting a treatment. Even if you had the perfect probability, let's say you want to match, ideally, what you would do in a propensity score match is to match the people that have exactly the same propensity score. But maybe there is no comparison in your data. So what you do is you say, okay, they don't need exactly the same propensity score. Let's increase it a little bit, the range that we will accept. Well, there is this trade-off. The more you increase the range, the more matches you will find, but the more they will be dissimilar on the propensity score. So what you do is that you use heuristic techniques to look at, okay, I created my matches. What is the balance between the variables that are potentially confounders? I want to make sure that they are balanced in both the treatment and control groups that I created after matching people together. But there is this trade-off. The more you are rigorous and stringent on the match, the less control matches you will find. So the more you will throw data away. But the more lax you are, you will find more controls, but then the matches will be less and less good. And theoretically, the propensity score matching promises that for people with the identical propensity score, right, if you match them identically, even if on the variables that went into the propensity score, they are not the same, well, on average, the distribution of the confounding variables will be the same in both groups, so it will eliminate the confounding. But in practice, you never have a perfect match. You relax your assumption, so you're always wondering, like, okay, is my balance good enough? But there are some ways to check this, at least for the variables you measured. So I think it's hard to say. I would tend to put it in unreasonable because I would want people to be cautious when using this technique. It's not easy to use, but it can be a very valid tool. Like Rubin used it a lot in a lot of his work, but Rubin, he invented the method, so he's pretty good at using it. But for others, you have to be careful. There's a lot of pitfalls.
Yeah, yeah, Justin. I think this has been a thorough masterclass. If I would recommend anybody to, follow one particular segment in this podcast, I will definitely point them to this particular section because I think you have explained all these assumptions, really well. So thanks for that. I think this wraps up our game. So let's move on to our other questions.
Thanks. I'm glad that you think it's useful, and I'm always happy to try my best to explain things. It's a passion for me, so thanks.
Yeah, I mean, if at all there were a masterclass of explaining, assumptions in quasi-causal methods, I think this would be it. The reason that I interview experts like you is because, they are the ones, who are able to deliver a masterclass because they have, experienced this, they have applied this in their field, and it really comes through that you know what you're talking about. Yeah.
Thanks.
Uh, so yeah, talking about, the next question, right? I mean, always causal inference methods are compared to, the traditional machine learning methods. Machine learning methods are really easy to prove and validate, right? You have a ground truth, you have a prediction, and you can always juxtapose them and say that, hey, look, we came very close to the ground truth. But causal inference are not that easy to prove. I mean, its efficacy or its accuracy cannot be proved that easily, right? How does one go about, proving the accuracy of a causal inference method?
Yeah. Well, like any inference technique, right? At the end of the day, you are relying on the validity of your assumptions. So I would take Rosenbaum's advice that I mentioned earlier, right? If you have no credible claim to why an assumption is not met or why it is implausible, then probably you should accept the assumptions. Of course, we could be wrong. The state of knowledge could evolve. We could realize that we were in error. But science has a beautiful way of bringing in people with different perspectives to study similar questions and to look at it from different angles. And it is this accumulation of evidence and accumulation of knowledge that eventually gives us certainty about things like, for example, it would be very, very, very unlikely and surprising that cigarette smoking turns out to not cause cancer, right? But how do we know that? Well, it takes a lot of understanding of the evidence. A lot of many studies were done, and the inferences are super credible. There's no alternative explanation. So I think it's a matter of finding alternative explanations and looking at them and probing the data. I don't think you can just do one study and end up saying, well, this is causal. There is no doubt that I have the right estimation. That is very rare, even with the RCT, because yeah, in an ideal scenario, the RCT works, but in real life, you never meet the ideal scenario. So
Mhm.
you are still relying on assumptions to make your inference. Yeah, I don't know. Does that answer your question? I think.
Yeah, it does. It does. Yeah, thanks
Okay.
for that. I mean, a couple of months ago, if I recollect correctly, there was one LinkedIn post of yours where you kind of, talked about the various causal inference softwares, libraries. If you were to recommend a particular, set of causal libraries or softwares, what would it be?
Yeah. So, well, disclaimer, I use R for my work mostly. I mean, I also use Python, and I've used Python quite a bit in the past. But in R, there is something I shared. There is so CRAN, which is the repository of networks,
Mhm.
has what they call a task view for causal inference. So it's kind of like just this HTML web page. It's
Mhm.
not pretty, but it has like basically all the R causal inference packages are listed in categories. So that is a great place to start um, if you want to use R. For Python, I know the basic Python libraries, they are more tied to Perl's framework. So you have DoY, EconML, just off the top of my head, because I don't really usually do much causal inference work in Python. But I think Python is also growing very fast in its adoption of causal inference. There is a lot of packages. There is people in the LinkedIn group that are sharing their developments and things like that. So I think any tool is valid. It really depends on your preference. Python is more popular in industry and with ML. R is more popular in academia, in biostatistics, and things like that. So depending on your field, you might prefer one or the other. I am not very
And
dogmatic
marketing as
on
well.
that.
We use
Yeah,
R as well for market mix
yeah.
modeling a lot. Yeah.
Okay, that's good to know. Yeah, so it depends on your field and your. I think, yeah, like I was saying, I'm not very dogmatic about the tool. I think R and Python are incredible. In economics, they use Stata. Personally, I don't use it a lot. I've used it in the past. Anything that is like R and Python, in a sense, are general purpose. You can do a lot with them. So I think learning any of those tools will get you far. There is not You don't need to over worry about what tool should you learn, as long as you learn one at least. And I wanted to add something else. Um, yeah, I just wanted to say, like, for my book, right now I am writing like everything, the case studies and everything in R. And as I said, I do not use Python a lot for my causal inference work. So, but I really want to share the case studies in Python. So I am looking for someone to help me translate it. I have a few people that proposed. So I would like also for my book to have a Python code version, because I think, as I said, I am not dogmatic on the tool, and I think it would be very good for Python users who are interested in causal inference to have the ability to do so with my book, to learn about it. So
Maybe you can use some, LLM methods. I think there are companies like Cursor.ai,
yeah, yeah,
and
I want to use LLM methods, but I would like also to work with somebody,
I understand. Yeah.
because yeah, yeah, it's more a matter of time and like, yeah, I could do everything myself, but I think it would be more efficient to work with somebody on that, especially because I am In R, I am very, very high level. In Python, I have a good level, but it would take me more time. So probably it's more efficient to work with somebody.
Yeah, but you always need to, unit test the codes. And I think causal inference codes are more like, the functional testing codes.
Yeah,
You need to be really sure about, whether what you want it to do is doing it. So
yeah,
you just can't blindly push the code into some LLM and say that he translate this R code into Python. So I understand
exactly.
the
Yeah,
flaws there. But yeah,
yeah.
talking about LLMs, I know in the beginning of the talk, we promised that we'll touch upon this. Do you think there is some hint of causal mechanisms at play in the way the LLMs are generating responses and giving it to the users?
Yeah, to be honest, I love LLMs as a tool. I use them a lot, obviously. But the whole like debates about what are LLMs doing and things like that, to me, it seems obvious that they are just like a super fascinating engineering product. And then are they causal? I mean, we did not put causality in them, so why would they be causal? And then the argument that, well, they just learn it by I don't know, by miracle or something. To me, it's not very convincing, especially when you can easily fool them into making like very basic mistakes that even a child would not make about causality or mathematics or other subjects, because that is not how they work. They do not work by understanding things. Okay, if in the language that you train them on there is causal language, well, they will learn about how to use causal language.
Mhm.
But apart from that, yeah, I'm a bit skeptical about any claims that they are causal or something. But I think they can be useful tools for causal inference or generating causal hypotheses, or
Mhm.
building a DAG, directed acyclic graph, right, where you want to model your system with arrows and things like that. There is research that is done, and they are not great, but again, they can get you maybe 80% of the way, right? Like they do on most tasks. They get you 80%, and then the 20% that you need to add in as a human, well, okay, at least they got you 80% of the way there. They can help you generate DAGs and things like that. But I don't think they have intrinsic causal skills or something. Even I don't know what that would even mean, but um, I think if we want to create a truly intelligent system, like that would match or surpass a human, which is, I don't know, the science fiction dream that we might meet one day. Um, well, then I think that you will have to put some sort of causal reasoning into it. And I think a lot of top experts in AI also agree with that, because causal reasoning is super intuitive to humans, and it's an important part of intelligently navigating the world, right? You understand that things cause other things, and um, without that, I think it's hard to be a truly intelligent system. But I don't
Yeah.
know. I'm not an expert in this area, but I think um, that makes sense to me, at least intuitively.
Yeah, I think that was a great answer. Yeah, so moving on to our last question, which classical causal inference books would you suggest to anybody, getting started with causal inference?
Yeah. So there's two books I recommend for like non-technical. I mean, there is a little bit of technical stuff. If you never study the technical topic, they might be a bit difficult, but they are general public. So there is Pearl's Book of Why, which is a fascinating book. Pearl is master storyteller. He also worked with a writer, I forget his name,
Hmm.
Dana McKenzie, I think. So the book is very well written. It's like very fun to read. I don't agree with everything he says about statisticians, but it's a fascinating book. Um, and then there is Rosenbaum, who I mentioned a few times, who has a book called Causal Inference. It's a small book. I wish I would have brought them to my desk and I could show them, but it's a
Don't
very
worry,
small
I'll
book.
I'll put the image. Don't worry. Yeah,
Okay, perfect.
yeah,
That one also is very fascinating. It's like more about the potential outcomes framework. There's no DAGs or anything in it. There's no graphs because Rosenbaum, as I said, he is the student of Rubin and he did a lot of work in that area. And I think it's a master book. It's very recent. I think it's like a few years old. It's a bit less popular, but I loved it. I think it's a very good introduction. And then if you want to move on and not just like learn about it from a distance, but you want to start putting your putting yourself to the task and learning the actual theory. So if you want a book with code, there is the mixtape, Scott Cunningham's book, very
Mhm.
famous. I think he's a very compelling storyteller. I think his examples are super interesting. He touches on both potential outcomes and DAGs, and he does a quasi-experimental methods towards the end. And he, if I recall from following him on LinkedIn, he is in the midst of publishing the second edition, which will be a lot longer, and there will be more stuff on synthetic controls because when he wrote it in 2020, it was still newish. And you see the chapter, it's a bit not rushed, but it's like very brushed, like just a quick portrait, and then he says like, "Oh, it's evolving so fast. I do not want to put more." So it will be good to read his new expanded synthetic control chapter when it comes out. Maybe it's already out. I'm not sure, but that book is great. The mixtape by Scott Cunningham. And then if you really want to understand the deep frameworks, there's no code, but you have the Pearl's Causality and um, the Imbens and Rubin, which is causal inference in social science, causal inference and statistics, social science, and biomedical science. I think something like that.
Mhm.
It's a blue book. It's very big. That one. So that one and Pearl's Causality, they are different, difficult books. You need to have a bit of mathematical training. And then another book that is on the same level, but it has code, but it's a difficult book, is the Hernan and Robbins Causal Inference What If. That is a classic. It kind of meshes both frameworks together in a very appealing way. It also is the only book that I know that talks about time varying confounding. So it's a problem in very prominent in epidemiology, and Robbins is like a pioneer of those methods. So that book is great. And then there is yeah, another introductory book. There's the Alex Molak, who is someone I know very well. I'm working with him right now on a biostatistics course. He's great. His book is Causal Inference and Discovery in Python. So that is great for beginners and has Python code. Um, and
Having read your book, I think I would suggest your book also to the users, but I know it's not publicly out yet. And I would
yeah,
also, highly recommend Matthew Stackwell's book, The Causal Inference for the Brave and True. So I
yeah, I
think,
haven't read that one yet,
yeah,
but it's on my list. I hear it's great.
yeah, I think we have summed up, all the classic books out there already. Yeah,
Yeah. Yeah,
yeah.
there's many other books and I share a lot of content on the books that I have. I have a few things on my profile and things. So if you're interested, you want to know more or even you want to learn about papers or something, just send me a message on LinkedIn and I'll be happy to point you to resources so that we don't list books for another hour because there's a lot of great ones out there.
Yeah, I'm sure our viewers will definitely go back to your LinkedIn profile and glean all the useful information. Justin, this has been really great, and I really thank you for your time. I'm sure we're going to have you back for more talks. I want to pick your brain on more advanced causal inference topics. For the want of time, I will not be able to do so today, but it will be a pleasure to talk to you about the causal estimates, the ATEs, CATEs, etc. As something that we didn't touch upon today, but that will be a topic for another day. But thanks for your time. It's really great. I hope you enjoyed the conversation as well.
Yeah, it was great. So I just wanted to say to the audience again, if you want to talk about anything related to statistics or causal inference or science, just reach out on LinkedIn. It's the easiest way. You can send me a DM. I usually answer all of them. So don't hesitate. And thank you for inviting me. It was really awesome. I hope that the people will like it. And it was a lot of fun. We've interacted a lot on LinkedIn. It's nice to finally like have a chat and go deep into things that we're passionate about like this. The questions were great. The format was great. I really enjoyed it.
Thank you, Justin. I hope to have you again sometime soon. Thank you.
Please don't hesitate. Have a good day.